Welcome to the Stress-Free Dentist podcast. I'm your host, Dr. Eric Block. As always, I want to inspire, entertain, and educate you on the best tools and technologies out there. My goal is to help make your practice and career more profitable, efficient, and most importantly, more enjoyable. And check out all of my nonfiction and children's books on Amazon, and check out the stressfreedentist.com for any upcoming events. And if you're feeling you're a dental professional that's burnt out, or you just feel stuck or want to get to that next level, visit the International Academy of Dental Life Coaches or www.iadlc.com, and we'll get you matched up with a life coach that understands dentistry. I also wanted to thank our amazing sponsor, Equa Marketing. They have helped me and my practice over the years to improve with SEO and website performance. And to find out how you can make your practice dominate in your area, go to www.equa.com/MSMSFD to book your complimentary meeting. Again, that's www.ekwa.com/MSMSFD. Hey, everyone. This is Dr. Eric Block. And, I really learned nothing about marketing in dental school. So I asked an expert to offer some marketing tips. This expert has helped me with website development and all things social media and organic SEO. It's the CEO of Equa Marketing, Naren Alru-Raja, and he's going to help us with some marketing tips. Tip question: what do I need to do to improve my local SEO? There are a lot of behind the scenes actions that need to be taken to have a strong organic presence on Google, and Naren is going to share some of those with us.
I want to take a minute to first thank Eric for giving me this opportunity to share this tip. Stress-Free Dentistry is an amazing platform. Eric, great job. Keep doing what you're doing. I'm Naren. I'm the founder of Equa Marketing. And when Eric approached me about a marketing tip, what I thought is to answer a question that I get a lot of. And that question I get a lot of is, what do I need to do to improve my local SEO? When somebody refers to the word local SEO, typically they means showing up next to the Google Maps. Now, one thing I want to say right off the bat is local SEO, which is you showing up on the maps, whether it's on a smartphone or on a desktop device, is closely tied to regular SEO. So for me, they are kind of one and the same. So when I talk about SEO, usually I'm referring to both local SEO and regular SEO. Now, there are 6 things Google cares about when it decides whether you should rank for regular SEO. Those are the same 6 things Google cares about when it decides whether you should rank on the map or not. I'm going to list them out and I'm going to share with you what they are. The first one is NAP, which stands for name, address, phone number consistency. Second one is backlinks, like which websites are linking to you? Are they quality links? Do all the pages on your website have links versus just 1 or 2? The third one is called EAT. Now Google is calling it EAT. E stands for expertise, and also E stands for experience. So Google wants to make sure that your bio is written a certain way. That's where the E comes from. A for authority. So, if you are somebody who's seen as an authority figure, let's say you have given talks and stuff, embedding those videos on the website the way Google wants would be very powerful. And T is for trust. So grabbing those reviews where people say wonderful things about you and incorporating it on your website, again, is one more way for you to rank more both on the local maps as well as on regular SEO for specific things. Next one is original content. So this is, again, something that Google is looking at very carefully. They have all kinds of rules. If you copy anybody else's information, forget it, you'll get banned. Reviews, I think, has a bigger role to play when it comes to local SEO than it does on regular SEO. So the reviews that you're getting, the Google is looking at how many reviews you have, how many are you getting a month, whether they have paragraphs in them. And of course, if they have paragraphs in them, what are the phrases or keywords people are using? So if somebody talks about Invisalign, when you are more likely to show up on the maps for a search related to Invisalign because the review literally talked about Invisalign. So if there are 7 people talking about Invisalign and the person who's searching is close to you, you will be near the top for Invisalign. Again, that's not the only thing, but having these paragraph reviews that are keyword rich will be really powerful. And last one is Google Lighthouse score. Google gives a score page by page, and how well are you doing on those scores? Again, if you're getting close to 90 in each one of those 5 things, then you have an advantage. So think about it like this. Google makes a lot of money from ads, $224 billion. So it has every interest to make sure that you don't get free traffic, whether it's on the map or whether it's on SEO. They're always trying to find ways to disqualify you. The way they do that is by changing their algorithms. So make sure that you're paying attention to these things, specifically Google reviews, if you really want to do well with local SEO. The last thing I want to mention is your Google Maps or your Google My Business page has to be optimized properly and has to be managed properly. If you have duplicate listings, there's a problem. So there's all kinds of best practices around your Google My Business page you need to pay attention to. If you like what I have to say, book a marketing strategy meeting, equa.com/DFT, ekwa.com/DFT. It's our gift to you. We spend 6 hours prior to the meeting researching how you're doing with local SEO, how you're doing with Google regular SEO, and then give you a report card. You're getting an A for a NAP, maybe a C for backlinks, etc., etc. Now you know where you stand. We'll also give you a plan to get you to the top 5%. That's going to have an unfair advantage when it comes to your marketing costs. So book that meeting, equa.com/DFT. Thank you so much. Really appreciate it, Eric, for this opportunity.
All right, everyone, welcome back to another episode, and I am joined by my good friend, Dr. Dar Radfar. How you doing?
What's up, Eric? Thanks for having me on.
So these three things sound like they have nothing in common, but sleep apnea, low-level laser therapy, and dental pet products. But we're going to cover all of these things in our podcast today. So Dar, first, just give me a little bit of background. Where do you practice? How did you get into dentistry? What's your story there?
Yeah, so I'm a immigrant from Iran. I escaped to this country back when I was 6 years old in 1983. And one of the things when we were going through the mountains of Iran was I was told to not fall asleep as I was on horseback holding the waist of this Kurdish man who was helping me cross the border. And don't fall asleep because I'll fall off the horse and fall off the cliff, right? And fast forward to 2009, I'm driving my car in Calabasas, California, and about a block away from my house, I fall asleep at the wheel and I crash my car into a tree. And so that kind of pivoted me from, I've been a dentist since 2002, but in 2009, I became my first sleep apnea patient, treating myself with an oral appliance after I couldn't wear that darn CPAP machine that most people unfortunately can't tolerate. So since I was patient 0 in 2010, I got my first appliance then. Since then, I've been blessed to help over 1,600 patients with oral appliances. I travel the country and do some talks on how to incorporate sleep apnea into people's practices. And I've developed some products with sleep and other things, including the pet stuff that you were talking about for better oral health care for humans and animals. And so my journey is many like what you guys have all experienced in the dental field. If you're in the dental field, is we try to do as many services as possible, but some services such as sleep apnea and snoring treatment for me has just become such a rewarding financial thing that gives me more free time, but more importantly, personally, it's just changed my life so I can sleep next to somebody and not snore and have more energy throughout the day and reduce all the medical things that are associated with sleep.
And not fall asleep at the wheel. That's super scary.
Yeah.
I was also my patient 0. I was my own first patient, and I think that's such a great way for dentists to get started, is to take a home sleep study, and be your own first patient. Now you've treated a lot of patients with sleep apnea devices, but you also teach other dentists, correct?
Yeah, one of the biggest things a few years after I started treating sleep is I started teaching sleep. And through my courses, I've taught over 3,000 dental professionals so far. And I love doing that because once you learn how to do this and once you see it, you can't unsee it. Meaning once you look in the patient's mouth and see lower anterior wear or scalloping of the side of the tongue, or you look at the medical history, you see high blood pressure, acid reflux, depression, frequent nighttime urination, so many things, history of heart attack, stroke, cancer risk, all these are, we call comorbidities or things that are associated with sleep. And I just open my, teaching my seminars. Hey, just ask when you see any of these things. Hey, Eric, how well do you sleep at night? Anyone tell you that you snore? Do you feel more tired throughout the day? And I would tell you some of the times they go, oh man, yeah, they share that information with you, like how much they're suffering. And then we can help them, with a home sleep test if they haven't had one, and then CPAP, oral appliance, or surgery. And that's kind of like sounds very easy, right? But through my full day course, I teach how to do this through a system, who to refer to for the home sleep study, who to use for medical billing, all that can really seamlessly help these individuals. So the more I help dentists get educated and hygienists get educated, the more they can help somebody. So God forbid they don't fall asleep at the wheel and crash their car into someone or something. And so it's my teachings is heart-centered. It's to pay it forward so dentists can help their patients through, and we're the only ones that can make that oral appliance if the patient can't tolerate a CPAP. And so, and also I do teach on how to make a really good income from this. At the end of the day, it's one of the biggest ROIs, if not the biggest in dentistry, because a $375 appliance can make you thousands of dollars. And it's okay to talk about money because we're all here to provide for ourselves, our families, and whatnot, but also to help save lives.
Can you actually clarify? So dentists are the only ones that can make the oral appliance or mandibular advancement device, which protrudes the lower jaw to prevent the tongue from falling back, which is most often the case with obstructive sleep apnea. But we have to get our medical colleagues involved, such as the primary care or sleep specialist. How does that all work?
So that's a great question, first of all, and I'm going to give you all a very, very, very cool pearl or marketing advice here. The medical doctors in the community, unfortunately, are not well versed. The newest studies have shown 5 times higher risk of cancer of any kind if a patient is not treated for sleep apnea. Now, I work backwards, so I'm thinking, does every oncologist who diagnoses a patient with any sort of cancer, do they give them a home sleep test to make sure the remission of the cancer is under control because the patient's not breathing, going through stressful fight or flight response, all the mechanisms that their blood flow, oxygen blood flow is kind of mutating because they're not getting any oxygen to their vital organs, but as it does that, it feeds the cancer cells even more. So sleep apnea is correlated with so many medical conditions, yet the doctors are treating the condition and not looking at some of the sources of the condition. 30% of high blood pressure patients are because of sleep apnea. You give 10 patients who have high blood pressure a CPAP and oral appliance, there's a likelihood 3 out of the 10 will be off their medication. So the medical doctors, really not every single one of them, especially not a large percentage of them, are well versed in this, knowing that I'm going to go ahead and do a cardiac workup, oncology workup, endocrinology workup for diabetes, this, that, and also help them get a sleep study. So it's our job as a dentist to look at these medical comorbidities and say, we know that there's a correlation between type 2 diabetes and sleep. Have you ever had a sleep study? You can help the patient medically by getting them tested. Now, this is the pearl that I was promising you that I was going to share with you. Once I get you, Eric, in my chair, we do a home sleep study, and you have mild, moderate, or severe apnea, I ask you on a sheet of paper, there's a list of 8 different professions in the medical field. Your urologist, your endocrinologist, your cardiologist, primary care, psychiatrist. All these doctors, I want their name. So if you saw Dr. Johnson, your primary care physician, I'm going to share the information that you and I discovered together through your home sleep study, and the fact that I'm treating you with an oral appliance because you don't want a CPAP and you're a candidate for the oral appliance, with every medical doctor that you've seen within the last 3 years. They get a letter from my office signed by me. I call it letter to the MD. Dear Dr. Johnson, our mutual patient, Eric, was tested with a home sleep study. The board certified sleep physician diagnosed him with mild apnea. Do you have any questions? Contact my office. And guess what? He just got a letter from a dentist, a little wannabe doctor. and that said, we're treating your mutual patient, and you may want to modify his high blood pressure medication, or you may want to, look at the glucose levels a little differently, because once you help them with the sleep, the medical doctors need to know to be able to modify that and maybe change their treatment protocols for the patient. So it's our job as a dentist to communicate with the medical doctors once we see 1, 2, 10, 15 sleep patients in our office, dental patients that become sleep patients, so that they are now, how do you think I do 20, 25 appliances a month? Its majority are from medical doctors in the community that I've already sent these letters to, and that they know Dr. Rad in the community has already serviced their patients, and they're happy. And so that is not only a big marketing tool, and Eric, how much does that cost you to communicate that to your medical doctor? Nothing. I mean, a letter. Maybe you take some time. You want to take some time to go meet the doctor and say, I know we've already had a mutual patient or two. May I come visit you, so I can see, where our patients go? And also, I may need a primary care physician to refer my patient to, because they don't have one for a workup after we see that they have sleep apnea. Or are you still accepting new patients, Dr. Cardiologist? Because his sleep study showed arrhythmias. Oh yes, so this is how I built my network of medical doctors in my community, and I showed how to do that on my seminars at Rad Seminar, how to be able to grow your book of business just by letting these medical doctors know what you do.
Yeah, that's a great tip to make the medical community aware, but it's also a great way of marketing and getting new referrals. Can you just clarify that the dentist needs a physician to write the prescription or the diagnosis? We need a letter of medical necessity to make the device, correct?
So in most states, there's only three states or 4 states in the country, a dentist can actually refer for a sleep study. So dentists can screen the patient, meaning talk to the patient, look at their medical history, look in their mouth, see the acid erosion, the lower anterior wear, the scalloping, large tongue, soft palate is droopy, and refer them for a home sleep test. The dentist can do that. The home sleep test has a board-certified sleep physician who will interpret the results of the test when they send the equipment to the patient and send you that sleep study. By the way, a lot of these patients already have a sleep study. You'll be shocked when you get that courage and say, hey, patient Eric, I've noticed your large scalloped tongue. I've noticed you're grinding your teeth. I'm concerned you're not breathing well. Oh yeah, I already got a sleep study 2 years ago, and they gave me that mask, and I hate it. Well, you already have a sleep study on hand. But to get one for an existing patient in your office, most states you can refer as a dentist to a home sleep testing company. Then you have a board-certified sleep physician send you the results already signed off. They don't need to go see a primary care physician at that point. That says treatment options are CPAP, mandibular advancement, or surgery. They are obligated to give all 3 options, whether they're mild, or severe. All 3 options should be given by a board-certified sleep physician who interprets the results.
Yeah, and I have a couple questions about clenching and grinding. And do you think there's a correlation between sleep apnea and clenching and grinding?
Yeah, great question, because we tend to make a night guard, right? An occlusal splint, maybe Botox in the masseter and temporalis. I'm a big believer in that for tight muscles and headaches and whatnot. It helps a lot. But a lot of times people are struggling for air. So the most of the time it's the patient who snores, mouth open, if they're still grinding their teeth. So I call it CSI dentistry, crime scene investigation, right? We look in the mouth. When I see lower anterior wear where they're grinding their lower jaw forward, they're doing their own mandibular advancement. They're thrusting their tongue forward. That is an indication that their clench/forward grind and the pits on the molars are occurring. That's all airway. Sure, anxiety and stress and kids and dogs and work and all that contribute to some of the clenching and grinding. But a lot of this is airway. You open up the airway with a CPAP or an oral appliance, their TMJ symptoms and their clenching reduces significantly. And I've noticed that with the 1,600 plus patients that I've treated with an oral appliance over the last 14 years.
Yeah, I've seen Dar's course, and he really takes a subject that people fear or think is complicated, and you really simplify it to help a dentist to not fear treating sleep and airway in their practice. Because let's face it, I didn't learn anything about this in dental school. Now, I think a lot of dentists are concerned about the fear that they're going to mess up someone's bite from the appliance. What are your thoughts there?
So as you know, fear is not a good energy to be in,
Mhm.
but I experience it, right? We can't be in fear of anything. I have a fear of my patient being part of the 4% of people who fall asleep at the wheel and crash their car. I have a fear that if they're moderate to severe sleep apnea, if I don't help them, 12 to 15 years off their life. We talked about the 5 times higher cancer risk. That's my fear. That's my conscience that I get concerned about. Making them a morning aligner in the morning when they wake up and they put in, which is basically a little wafer, and the lab can make this for you if you don't want to make the Boylan bite one in the office. That morning aligner to wear for 2 or 3 minutes in the morning minimizes any sort of bite shifting or changes over the years of wearing a mandibular advancement appliance. Of course, informed consent forms that I give for people who come to my courses and take my full day course, that all explains that in there. You got to remember, these patients are suffering from some sort of condition. Usually it's just being really tired, or medical issues, or sleeping next to a bed partner that's been complaining they don't sleep in the same room as their significant other. A little bite change here and there, and informed that that can happen, plus the fact that you have a morning aligner that minimizes that, that you use for 2 or 3 minutes to put the bite back into centric relation or centric occlusion. That's all minimal, and it's nothing that should prevent us as a duty, because we are the only profession that can make this mandibular advancement. The ENT can't make it, the MD can't make it. With all the respect to hygienists, they can't make it. A DDS or a DMD is the only person that can make it. And it is technically, I believe, the first line of defense after CPAP, because surgery is radical. And a lot of people don't wear their CPAP more than 5 days a week, 4 hours a night. By the way, CPAP compliant, the patient who wears the CPAP beautifully in the medical community, is only wearing it 5 nights a week for 4 hours a night. That to me is still not enough. And I wear my oral appliance 7 nights a week, 6 hours a night. And majority of patients, they don't take it off to go to the restroom in the middle of the night like they have to with their machine, and then don't bother to put it back on. Their mouthpiece is in their mouth the whole time until they get up in the morning. So the compliance is what really makes the efficacy here with the oral appliance better on paper compared to a CPAP machine. And it's our duty to help them and not worry about bite changes, give them the informed consent, and you're preventing so many other things. And let's not have that fear of bite change prevent us from helping them.
Yeah, so personally, when I have the patient come in for the device, I have them lying back in like sleeping position, and I have it so that their lower jaw is a bit past protrusive, or a bit past edge to edge. And then I take it out, and have them sit up. And the morning repositioner, I have them, while they're sitting up, they just bite into it, into their MIP, and they have that. So some people, wear it on their way to work for like 10 to 15 minutes in the morning. Personally, I don't need mine. Some patients have told me they don't need theirs, but it's such a great way to reduce that hesitancy to get involved with sleep and airway with the morning repositioner.
Yeah, the morning reposition will cost us, each wafer costs us $10 from lab to make. If you want made one out of acrylic, similar to an occlusal split, it's like $90 or something like that, typically from most labs. And yeah, I don't use my morning repositioner either. And I've been wearing an appliance for 14 years. Just because I don't, my bite sinks pretty well. I chew something in the morning when I get up. That's the other thing. If you eat breakfast right away, your muscles of mastication will put you back into the MIP position. So you won't even need that. So if you're edge to edge or class 3 already and you're making no appliance, that's when you probably will see a little bit more of a bite change because of the stretch of the jaw muscles that are happening, and even that takes a while to show up. So I kind of push the morning aligner more on edge to edge or class 3 patients.
And if they're coming back with any TMD issues, do you bring them back less protrusive or just not have them wear the device for a bit?
Yeah, if there's a lot of, I would say 1 out of 10 patients do, from what I've experienced, do get some TMD. If they're a little too far forward, I bring them back about 10%. 8 turns on a sleep herps is about 1 millimeter on each side because it's 1/8 of a millimeter of a turn. And I show all that through my seminars on how to do it. It's super easy. And so that bringing them back and not wearing it for a couple days. Sometimes I'll advise them to take some sort of anti-inflammatory like Aleve. That works really well. One Aleve for 2 or 3 nights in a row. That'll lessen the exasperation of that TMJ just being kind of pulled a little bit. And so again, these patients are excited. They're not just being told you need an implant to replace a tooth so teeth don't shift, or it'd be nice for your hygiene if we do 20 trays of Invisalign for $5,000+ that we charge. These people have gone through sleep studies. They've had medical issues that they know that are possibly lurking, and they have embarrassment issues by sleeping next to people with snoring. You don't need to sell anything here. The appliance does the selling for you when it's working. And if there is a TMD issue, that's treatable. You may have to have them stop. I've had some patients stop for a whole entire week, and then I ease them back into it, 0.5 millimeter increments every other week to bring them to that ideal position where they're telling me that they're not snoring, or they feel more energy throughout the day. They're not getting up as much to go to the restroom. And then I do a follow-up home sleep study with the appliance in when we know that the patients, has all those check marks that they're feeling better, and making sure that AHI is where it's at. Have I had people go from AHI 25, which is the high moderate, down to 16, and that's the maximum I can go because their jaw is hurting them? Yeah, that's the most I can do for them. If they want to try the CPAP, they can, but a lot of them feel good and it's better than what they were. It's not a perfect science sometimes, but anything is better than nothing when it comes to sleep apnea.
And talk about the medical billing. What's billable, and is it even possible to get reimbursed by medical insurance for sleep apnea treatments?
Yeah, I always recommend any dentist who takes my course and starts doing this or has been doing this, here 1 or 2 appliances here and there, is to use a medical billing company. And I still have a medical billing company that I use because I walk the walk, talk the talk. And code E0486 is the sleep appliance FTA Medicare approved code to be able to bill PPO medical insurance and Medicare insurance. On average reimbursement, the deductibles is what needs to be looked at. If you have a 5,000 or more deductible, you're just going to be eating up the deductible for the patient. So it's a cash patient. I personally charge $2,950 for an appliance. They pay cash. And if when the medical insurance pays, we reimburse the patient their fee, and we keep the amount that we've got as long as it's over the $2,950. Up to that amount, we just reimburse the patient. My minimum reimbursement is $2,950. I've gotten $7,600 checks day in and day out for UPS employees because they have very low deductibles and their coverages are very high. The billable amount is $9,500 for the appliance. And when I say that in my courses, like, how much are you happy with, Eric? I mean, how much are you happy with medical insurance paying you, or even a cash patient, for doing all the things that appliance will do? How priceless is that? I mean, if I had my appliance in 2009 because I was told I was snoring and I was feeling more tired throughout the day, I had no idea what was going on. But if a dentist looked in my mouth and saw some of the, my scalping of the tongue, my high arched palate that was there back then, I could have avoided that accident. And what cost? How much is that worth for me? Right? That's just an accident. We're not talking about sleeping next to a bed partner that's embarrassing, or so I believe that reimbursement from medical insurance ranging up to $9,500 is very fair, if not actually on the low end. A study has shown that over $520,000 of medical expenses has occurred for a patient who's not treated for even mild sleep apnea. So that's why they do pay as long as those deductibles are low or have already been met. And I show you guys how to do that in the courses that I do, because that is a big topic. But I have a question for you. Do you place implants, Eric?
Mm-hmm.
Okay. Does dental insurance cover implants every single time?
No.
No. And then we have the $1,500 max, anywhere from $1,000 to $2,500 if we're lucky. And most of the time it's already been either fulfilled or a lot of it's been used up. We still talk about doing that implant on number 30 for $4,500, right? Extraction, bone graft, implant, abutment, crown. As dentists, we bring that up. Or Invisalign, not after 19 years old, ortho is not covered for most of these claims, and we still do it. In doing sleep apnea, you charge the cash fee, you send it off to the medical billing company, you get paid, great. Reimburse them for the amount that they paid you. You get paid over $29.50, that's what you keep. And there's a financial arrangement form that I have the patient sign that explains all that.
Now, speaking of medical codes, Dar and I have been very involved with Zirconia lasers, which is a low-level laser therapy, a cold laser therapy. And there's actually, you're actually able to bill for, is it post-operative pain?
Yeah, there's a new code that came out January 1st, 2024, 97307. And it basically says that you could use low-level laser therapy, such as the EVRL, which is the laser from Zirconia that you and I have. And then there's the FX405 machine that they also have, that when you place it, so this is what I did. I've done it for 10 patients already this year. Two out of the three, two of them have already paid me. The medical insurance has for the procedure. One, she had a deductible, so it went towards the deductible. The other 7 I'm waiting for. The range of payment was anywhere from $263 up to $700 per session of using this laser. Now, how do I use it? You come in for extraction on number 19. I numb you. I put the laser on the area. It's a cold laser, so it's not like hurting. You don't even, if you use it for TMD or any other post-operative pain, or people's back, neck, shoulder, for if you do TMD, you don't need to numb it with numbing gel or numbing cream or anything like that. And so, for example, in this case, pulling a tooth or putting an implant, numb, put the laser on for 5 minutes, set at the post-operative pain wavelength, then take out the tooth or place the implant in, put it on for another 5 minutes, the patient goes off. Clinical studies have shown 45% reduction in post-operative pain. More importantly, accelerated healing due to the anti-inflammatory of how the mitochondria gets stimulated by this low-level laser therapy and produces more ATP in the mitochondria. That itself produces certain enzymes that reduce inflammation. Less inflammation, quicker healing. So not only are you reducing the pain by 45% for patients, so they're less likely to take Advil, Motrin, Norco, Percocet, Tylenol 3, whatever that they're asking for, and we try to minimize those pain meds. But it's also billable now under medical insurance, and my medical billing company is well versed in it, the one that I use, and now we're billing that code along with office visit codes that you can bill, 99205, 99215, which are office visit codes for time spent doing an exam or doing a procedure. So these things are great revenue generating options for our practice, and also help with our way of doing our dentistry, because the low-level laser therapy reduces that post-operative pain. And that's kind of really exciting, because we all want to have less pain when we leave the dental office.
And the Zirconia laser is very different than your typical laser out in the dental market. Most of the lasers out there are some form of cut and cauterize or heat up. This is totally different, correct?
Yeah, it's not like the EVRL looks like your cell phone almost, like a iPhone Max. It's a handheld, and it goes on a little stand, and it points to the area. Again, like you could use it on anyone, and you don't feel warmth, you don't feel discomfort. The wavelengths that it's sent at, the violet and the red light that as it hits the tissue, the cheek area, the temporalis, the masseter, it's just reducing the inflammation and allowing more blood flow to the area for healing. It's brilliant. I mean, for it to be FDA cleared for postoperative pain, and now medical insurance is paying for it. I mean, it's a game changer in dentistry. And you and I are kind of like just the beginning. I feel like we're the pioneers starting this, because I'm excited, because it's clinical and it's financial, and that's kind of like what excites me in the courses that I teach is we got to talk about some money. Sometimes we've seen instructors, all they do is put up slides about, you know, studies that have been shown, and it's nothing to do with adding revenue to your practice. And let's not be shy from that. And our corneal lasers are now adding that to dentistry, so it's a game changer.
Yeah, I'm super excited about, you know, to see how this goes and where it takes us with the laser, because it's, you know, it can help in dentistry. It can also help with yourself and your, you know, your family. If you're having any aches or pains like neck or trapezius pains or wrist pain, you can use the laser on yourself, which is I find super helpful. But super exciting to find out, you know, how much we can use it in dentistry. All right, so let's get into Rad Pet. I just got a mini poodle, banded. My little mini poodle, he's so cute. How does Rad Pet dental kit, how does that work for pets?
So, you know, at Rad Health, you know, kids call me Dr. Rad at the office, so everything became Rad. My sleep supplement, Rad Z's, helps you sleep better and breathe better, and it helps with your snoring, actually. And I've created like 10 different kind of products. One for the TMJ called Rad Jaw, helps with the inflammation of the jaw and the popping and clicking and all that. And about a year and a half ago, I was walking in the streets of Sedona. And Sedona, Arizona is very spiritual. If you haven't been, it's got a little energy to it. And, you know, we've all become a little bit more spiritual. I'm assuming some of us have become more or meditating. We're talking about manifestation and having positive thoughts. And I've never been a huge pet person. I got attacked by 2 dogs when I was a kid, so I had a little bit of a fear of dogs. And I saw this psychic medium person in Sedona, and she looks at me and she goes, "You help people with their mouth, but it's people. Your calling is to help pets." And I said, "Well, okay, wow, that's kind of random how she would pick that out." And I said, "Well, I'm not a vet, but me, but you're right. I do help people with, you know, oral health." Saying, "No, your calling is is pets." So I thought to myself, I said, "Is there something out there that has a kit for pets and pet owners to use on their dogs and cats?" And as I looked, they have these toothbrushes and finger brushes and all this other stuff. We did some research, my team, and we surveyed about 450 pet owners, and they all love the fact that I have 3 products in this Rad Pet Kit. One is a water additive. So a third of the cap, you put that on the bowl of water for your pet. And as they're drinking it, there's enzymes in there that help with bacteria and with plaque reduction. So that doggy breath gets improved, that people don't hate, that goes on their fur around their mouth and whatnot. I call it the lazy way of keeping your dogs and cats healthy, is the water additive. Just add it to the water. Then I created these little dental wipes. It looks like a little 2x2 gauze with prophy paste on it and with toothpaste on it. And so you can use this gauze or this dental wipe and wipe their teeth with it, because they're less likely to get upset if you're using, which most people think, just a big toothbrush with a long handle and toothpaste. Some dogs don't like having a toothbrush put in their mouth. Most dogs don't bite their owner's fingers. So included in the kit, I did include a couple silicone finger brushes where you can put the toothpaste on and brush their teeth if you don't want to use the regular toothbrush. So toothbrush, finger brushes, and toothpaste is one. The dental wipes is another. And the water additive is a third. And all of that is put in the Rad Pet Kit. And you can look at it at rad-pet.com. And it's been working wonders because the dental hygiene for pets is so crucial to their overall health of their heart, their kidney, their immune system. There's been so many correlations, and sadly we neglect that, and they're a part of our family. I mean, you got so hyper and excited when you're talking about your dog, and it's only been a few months, right? There's this unconditional love that they give us, and it behooves us to be able to take care of their oral cavity, especially if we're in the dental field. You got to walk the walk, talk the talk for everybody in the family, including our pets.
It sounds like that person in Sedona like looked through your soul and said, "You are the rad pet guy." And I'm glad you did, because I put that little silicone brush. I actually put it on my finger. I wedge it into Bandit's mouth, and then with my other hand, I go to town with the toothbrush. And he doesn't like it, but he forgets. You know, he's a dog. He'll forget like 5 minutes later, and everything's good. And he's my little bandy boo. Um, it's an awesome kit.
Thank you. Yeah. And
Awesome.
you should get dogs should, how humans, we get our cleanings every 6 months, 3 to 4 if we have perio disease and need more help. Pets should be once a year. That's the guidelines by the the Vet Association. And cleaning your dog's teeth should be done daily, once a day. And so if you're not brushing, at least using the water additive, hopefully brushing maybe 2 or 3 times a week. But again, it should be done every day, just like we brush our teeth at least twice a day, to help with the microbiome that can form around the plaque and whatnot of the teeth.
All right, awesome. I want to end up with 2 final questions. Number 1, how do we find out more about what you're up to? And then the second question is, what advice would you give to the young dentists out there?
So for the seminars to teach you how to do sleep and to come on and have a great time understanding how we can save lives and get people sleeping next to each other, the fun stuff, radseminar.com, radseminar.com has all my courses to come on and hop on. I do some free webinars, 1-hour webinars, and I have full courses, virtual full-day courses and in person. And for the products, you could go to Rad Health Inc., radhealthinc.com. You'll see the Rad Pet product, the Rad Z's, all the different kinds of stuff that I have. If I've been a dentist for 22 years. How many years have you been, Eric?
Just about 20.
Yeah. So, we're hitting a stride, right? And if I were to go back and think, what would I do differently? I learned how to do Invisalign in 2003, a year after school, after graduation. I learned how to do traditional braces through Progressive Ortho in 2008. I learned how to do sleep in 2010, years after I started practicing dentistry. My advice is, we got a menu that we offer. Anything that interests you, get educated as soon as possible so you can provide more services in your office. Not only will that generate more revenue, but it's kind of like keeps the day going. I'm the type of person that, like, I do 30 crowns a month on average. I'm still your dentist. I practice only 3 days a week now because my sleep program is doing really well. So I do a lot of sleep apnea that takes the strain off my neck and my back and my arm and whatnot. And so, like this EBRL and FX405 laser from Merconia, we're putting together a course on Dental Flicks for the laser. Get trained on how to use this. This is going to be revolutionary in helping with postoperative pain and inflammation and healing. And also it helps add revenue to your practice. So learn more, educate yourself more, go to courses, go to conferences, network. And within years after your practice, you're going to be doing much, much better than others.
Yeah, a lot of what you just said is exactly what I write about in my latest book, Stress-Free Next Level Dentistry. And Dar was nice enough to give me a collaborative section on it. And it's so true. Get yourself trained, get educated, and just keep adding to your menu of what you do. And it keeps things, re-energizing. And it's so great for you, for your practice, for your patients. Dar Radfar, such a great episode. So many great nuggets. Thanks so much for joining us.
Thank you so much, Eric. And great job on the book. I love it. And thank you for letting me be a part of it.
All right, my man. Take care.
Okay, thank you.
Thanks again for listening to the Stress-Free Dentist podcast. And don't hesitate to get in touch with me at info@thestressfreedentist.com. And if you haven't already, please subscribe on your favorite platform and leave us a review. Until the next episode, I'm Dr. Eric Block, the Stress-Free Dentist.